Hello, and thank you for the opportunity to present this brief overview of OneRx and how OneRx is addressing the opioid epidemic with pharmacists on the front line. From 1999 to 2016, more than 200,000 people have died from overdoses related to prescription opioids, with an estimate of 46 individuals experiencing death each day in the United States. Approximately 1,000 individuals seek medical treatment in the emergency room each day for prescription opioid misuse or overdose. Members of a research group at the North Dakota State University Department of Pharmacy Practice asked the question, how can we better equip community pharmacists in battling the opioid epidemic in North Dakota? The OneRx program was developed. OneRx stands for Opioid and Naloxone Education, and its foundation is an innovative screening tool created by the research group. This screening tool is completed by patients at the pharmacy while filling in opioid medication. This risk screening assists pharmacists in identifying patients who are at higher risk for adverse opioid events, for example, opioid use disorder and/or opioid overdose. This helps pharmacists to focus their consultative services and interventional resources to high-risk patients. 6 critical interventions were used to measure the efficacy of the patient-specific interventions that OneRx offers during pharmacist care provision. These include, but are not limited to, explaining the benefits and availability of naloxone, dispensing naloxone, contacting providers if concerns with prescriptions are identified, explaining what opioid use disorder is, discussing risk for accidental opioid overdose, and discussing community support services as a resource for patients. What has been the impact of the OneRx program? Since October of 2018, over 7,500 patient screenings have been completed. 77 pharmacies have enrolled to participate in the OneRx program. 88% of patients were introduced and educated about the medication take-back program for disposal of unused opioid medications. 25% of individuals were identified as high risk for accidental opioid overdose. The benefits and availability of naloxone was discussed with 33% of patients, and 93.4% of patients who are at risk of opioid overdose or opioid misuse received one or more of the critical interventions to promote safe and responsible prescription opioid use. The OneRx program has gained national attention as pharmacists are at the forefront in promoting safe and responsible prescription opioid use in the goal of preventing adverse opioid events in our patients. Thank you.